Today we intend to highlight the difference between anxiety and panic disorder. If you are struggling to know the difference, then this video is for you. Although it can be distracting and distressing, anxiety is a completely normal part of life. Everyone will experience bouts of anxiety at some point in their lives, usually surrounding a stressful event such as a job interview, exam, or before public speaking. In recent times, lockdowns, homeschooling, and other pressures brought about by COVID has seen a significant spike in anxiety levels. Generalized Anxiety Disorder, GAD, on the other hand, is diagnosed rarely, with only 18% of us being diagnosed in 2020. But what is it? According to psychiatric mental health practitioners, anxiety is a common experience. However, when the presentation of anxiety meets certain criteria in regularity or severity, it can quickly become a disorder. The same relationship distinguishes an individual's panic attacks from panic disorder, a chronic and distressing condition that affects 2 to 3% of us. Recurrent panic attacks can be considered panic disorder when the individual begins to live in fear of experiencing more attacks, thus interfering with everyday life and often triggering yet more attacks. A panic disorder is often misunderstood as being severe anxiety. Whilst the two are very relatable, due to panic disorder falling under the category of anxiety disorders, they are not interchangeable because of the distinct ways each affliction presents itself. Here are 5 significant differences between anxiety and panic. 1. Anxiety lasts much longer. Fortunately, for those who suffer from panic attacks, episodes are usually short-lived, and although scary and deeply affecting, they come and go with little in the way of long-lasting effect. In severe cases, multiple rolling attacks can come and go for several hours at a time, which is far more concerning for those affected. Of course, the frequency of panic attacks varies from person to person, so no two experiences will ever be the same. Anxiety, on the other hand, is much more long-term, and can be thought of in terms of change in one's everyday behavior, rather than a sudden onset of severe distress. Symptoms can last for years, even with treatment, but, just like panic disorder, no two cases of anxiety will ever be the same. 2. Anxiety is general, whilst panic is more specific. In clinical terms, a panic attack is a specific event that occurs with clearly defined characteristics and involves feelings of intense fear, danger, dread, or doom, whereas anxiety is a more general term related to stress and worry. Neither an anxiety or panic attack needs a specific trigger to cause it, but anxiety can also cause generalized stress and worry about the future, past, and even hypothetical events. Panic attacks often occur out of the blue, without any triggers present. Unfortunately, this doesn't mean that a trigger or triggers for panic don't exist, but the lack of causality can make these seemingly random attacks far more distressing. Anxiety attacks, though, typically occur in relation to a specific event, situation, or thought that triggers the unwanted response, while anxiety disorder can disrupt a person's life, even when the triggers are not present. 3. The symptoms are different. Although both disorders are based in a severe sense of worry or fear, they express themselves in different ways. According to experts, the symptoms of generalized anxiety disorder include more generalized emotional symptoms such as irritability, feelings of worry or dread, trouble concentrating, and feeling tense, or generally on edge. The symptoms of panic attacks, on the other hand, are more severe and come on more abruptly than symptoms of GAD. These can include sweating, shaking, chest pain, a rapid heart rate, and even numbness, or a sensation of choking. 4. Panic attacks are more sudden. Symptoms of anxiety attack tend to show themselves gradually when exposed to their trigger. When anxiety disorder becomes long-term, though, symptoms can become so constant that it can be hard to tell when they begin and when they end. Anxiety may also begin to cause more intrusive symptoms that occur more frequently when stress triggers are not actually present. A psychologist would likely consider this to be a symptom of anxiety disorder. According to the professionals in this field, panic attacks are much more distinct. Symptoms appear suddenly and noticeably, rather than building up gradually over time. Due to this onset being so abrupt, and the acute nature of panic symptoms, such as chest pain and shortness of breath, it has led many sufferers to mistake their symptoms for a heart attack. Luckily, panic attacks are not life-threatening and will often resolve themselves in fairly short amounts of time. 5. Panic attacks leave you feeling out of control. For many, the scariest symptom of a panic attack is the mental unrest, rather than the physical sensations. In recounting these experiences, sufferers often report feeling withdrawn from their surroundings, as if the world is not even real anymore. It is also possible to suffer something called depersonalization, which could be likened to an out-of-body experience, or being separated from oneself. Many do not realize that these feelings are related to anxiety or panic, and often attribute them to something else entirely. Once a sufferer has taken the time to rationalize these feelings or sensations, and recognizes them as a symptom of a panic disorder, they often become affected far less in the future. In summary, the main difference between anxiety and panic disorder are: 1. Anxiety lasts longer. 2. Anxiety is general where panic is more specific. 3. Panic and anxiety have different symptoms, with anxiety involving symptoms such as irritability, while panic attacks can include shaking, chest pain, an increased heart rate, and even numbness. 4. Panic attacks are more sudden. 5. Panic attacks make you feel out of control. We at Be Inside hope that you have found this video helpful. Please take the time to subscribe for further similar content. Feel free to make a comment or suggest a subject you would like to see covered in future videos. In the meantime, thank you for watching.